Studio Me Productions is a full-service video production company based in Pittsburgh. It offers custom video production services, podcast studio rentals, and communication studio build-outs. Choosing Studio Me Productions means investing in a partnership that values creativity and delivers results that exceed expectations. With a deep understanding of marketing and storytelling, Studio Me ensures your project will captivate and engage your viewers. Learn more at studiomeproductions.com. That's studiomeproductions.com. A strong work culture is the invisible force that binds employees to each other, to the company, and to their work. It's linked to better business outcomes, happier employees, and increased retention. How we work and where we work continue to evolve in almost every way, yet our human need for connection and purpose remains. Help your employees connect and thrive by evolving your culture to support your team, regardless of how or where they work. So discover how the Kindling Culture Agency can transform your company's culture at sparksomething.big.com. That's the Kindling Culture Agency at sparksomething.big.com.
CompUnetics is the leading developer of unified voice, video, and data collaboration and conferencing applications for the service provider, government, and unique workflow applications. The Summit Olympus and Evergreen platforms, driven by their encrypted user interfaces, enable powerful and secure collaboration. Combined with world-class support and innovative professional services, CompUnetics delivers the right solution every time. Learn more at compunetics.com.
This is TechVibe Radio, your front row seat to Pittsburgh technology and innovation ecosystem. TechVibe is brought to you by CompUnetics at compunetics.com, Huntington Bank at huntington.com, Kindling Culture Agency at thekindlingcultureagency.com, My Benefit Advisor at mybenefitadvisor.com, PNC Bank at pnc.com, Savior at savior.com, and Studio Me at studiomeproductions.com. Coming to you from the Huntington Bank Studios, here are your hosts, Audrey Russo and Jonathan Kersting of the Pittsburgh Technology Council.
It's your front row seat to Pittsburgh's technology and innovation ecosystem. Audrey, what a great week we've had.
It's been a great week.
Oh my goodness. First off, I'm a little jealous.
Were you?
Yeah, because you got to have a fireside chat with Mark Sevco, the president of Allegheny Health Network. I mean, he's pretty high up there guy when it comes to our ecosystem within healthcare, obviously.
It was a good opportunity to talk to him. I mean, I loved being able to hear his story.
Yeah.
30 years at UPMC, born and bred in the middle of the state.
Yeah.
He considers himself...
Lebanon, PA, I think is what he said, right?
Yeah. He considers himself a Pittsburgher.
Okay.
He went to the West Coast.
Yes.
So he got immersed in the scene out there in San Francisco.
Got a little touch of San Francisco
Got a little touch of the innovation,
right.
investors, etc. He was at sort of the forefront of a partnership with Abridge when he was at the previous gig.
Exactly.
And then brought that into AHN. So that was great. So he got a chance to...
Tremendous opportunity. And this is part of our Huntington Bank Breakfast series. I mean, funny, Huntington Bank studio here, but also Huntington's also our key partner with us on all things with our breakfast briefings. And Audrey, we do these breakfast briefings because we want to bring these leaders out into the public so they can meet with the people, for lack of a better term, give our members, but give people in the community an ability to kind of learn from them and connect with them.
Right.
And that's something that he did. He was connecting with everybody at the event.
He was so gracious.
Really nice guy. He was
so gracious. Interested in meeting all sorts of people, from startups to more established companies.
Yep.
And he took the time with each and every
100%. all the way around. And it was just amazing. And so I thought it'd be fun for us to kind of delve into some of the action.
Yeah,
you got to
sure.
ask all the questions. And I just want to talk about some of the areas. And I had some clips that I pulled from
good.
the interview that we'll kind of put in as we kind of talk through the whole narrative of this thing. Because I don't know, I mean, we've done tons of breakfast briefings over the years at the Pittsburgh Tech Council. I mean, our last one was with Mayor O'Connor, of course, which was great back in February for us to learn about like how he wants to make things better for tech here in Pittsburgh and let tech companies thrive and succeed. So that was really fun. And I think we had a great follow-up by having someone like Mark Sevco stop up and talk about how he's working. And so the big thing for me was he gave that little introduction of himself. And I think that introduction that he gave just really kind of sets the tone. Let's check it out right now.
Well, it is a privilege. It's a very unique opportunity to be in healthcare. There's so many changes and headwinds right now. Yes. You know, I'm a Pittsburgh guy, right? So I went to school at the University of Pittsburgh, got a degree in applied mathematics and MBA, MJ. I spent 30 years at UPMC. Did my last role there was president of the hospital division and ambulatory. And I went to the West Coast for a short period of time to be in Northern California, a longer period of time. Okay. Was chief operating officer of Southern Health and had a unique opportunity to come back, work at Highmark then. It's just really unique for me to have, you know, the history in Pittsburgh and different systems. And I just, you know, thrilled to be here. We're working on a lot of great things at Highmark and AHN and look forward to sharing a lot of that, you know, with you and certainly with the others.
Back at it. So like I said, yeah, he just seems like my kind of a guy. I got to talk to him a little bit before the event. I'm like, oh, this is going to be so much fun. So I'm just real fast. What was one of your key takeaways, Audrey, from being able to interview him up there on stage?
Well, I think, you know, first of all, when someone has the responsibility of like $5 to $6 billion,
yeah, you know,
in terms of a budget, right?
Billion here, billion there.
Well, but I mean, he really was talking about, I mean, the margins that are, you know, as we start to face some of the headwinds that he talked about. That was really a big takeaway for me. And he talked about the big, beautiful bill and the imminence of that and what it was going to do for people who are on Medicaid.
See, that was an interesting perspective because I don't know that much about it, but what I did learn from the event, like especially if there's some areas just even within the pharmacy side of that where people could literally be losing their prescriptions because they won't be covered.
They won't
anymore,
be covered, and
which
there's
is
a whole
scary.
set of requirements.
Yeah.
And so what happens is in those kinds of situations, it puts different stress on the system.
Okay.
And so when people are losing their benefits, it affects all of us.
Oh, 100%.
So that's the thing that people really don't understand.
It affects everybody.
All of
it
us.
does, everybody.
Because, you know, these are people who now don't have a pathway into getting care.
Right.
So they will tend to put pressure on systems like the emergency room. And they'll start to utilize things when they don't have opportunities for preventative care.
Exactly.
And so then there's a flare up, or then there's
and that's
a situation.
that's the pricey
and
side of it, right?
Well, that's the pressure side of it. The pressure side of it is, so if you really have an emergency and you've got coverage, but then I have an emergency and I don't have coverage, we're both going into the same funnel.
Yeah.
But you may have had preventative care, but I may have not, because I lost my ability to have that kind of coverage. Yeah. So there's new regulations, criteria that's being put into place.
Interesting.
Which means that if you're on Medicaid and you're quote unquote somewhat able-bodied, you have to volunteer, you have to work part-time, you have to demonstrate some of that.
Oh yeah.
But there will be people who are left out. And so he's saying, how do we get like ahead of that? How do we prepare for
Exactly. And that's why it's so cool we have him come and speak about this, because it gets our minds to think. As a business owner, you're not looking at it at that depth, but once you see that, you start to plan and adjust what that means and how you
or you can be an advocate, or you can have a voice outside of your own business to understand the impact of that.
No,
but it
100%.
also impacts the price of insurance for all of us.
Yeah. One thing that I was really excited about that he talked about, because of course this is Tech Vibe, we're a tech show. We like nerding out on the technologies and so forth.
Well, that's why I mentioned Abridge earlier.
Yeah. Oh, we'll jump into that, because that to me was just that's some really amazing stuff. But he did a lot talking about like chatbots and Epic that they use and how they're really just embracing with a big wet sloppy kiss AI, as they should be. And to me, I think there's a cool clip I have here talking about some of that. Can we give that a listen real fast?
Yeah, let's do that.
This might spark a memory for you here, Audrey. After all, you were the one up there on stage doing all the interviewing.
In healthcare, one of the things you'll hear from me is we can do so much better, for our patients. We can help them, navigate, meet them where they're at. And really, technology can play a significant role in that. So there's so many great ideas right now, certainly with AI, so disruptive right now, whether it's ambient listening, ambient recording, whether it's, startup companies that are really trying to do their best and working with us to, well, I always talk about, are we making it best for our patients to create pathways that are simple, that are reliable and quick? And the answer to that a lot of times is no. Patient scheduling, is it simple, reliable, quick? I mean, maybe, but there's so many different things right now around technology. We have an electronic medical record system that Epic is our system, and we're really, trying to learn how to leverage those capabilities. But I would say AHN's coming at it from a consumer satisfaction perspective. We got to be obsessed with patient satisfaction. Where do our patients need the most help in navigating healthcare? And how can we use technology to be able to do that? Chatbots, a lot of different things we're going to be trialing and getting feedback from our patients, but it's an exciting time. The predictive analytics, we could talk forever about, the importance of meeting, like customizing care for you, where you're at and what we know about you, and the predictive analytics around the pathway to keep you well, healthy, and living a long life. One of the things we have to do is be very open to new ideas, right? So we talk about it a lot. In order for us to be the best, we have to be very creative. We have to understand how we are actually creating a roadmap to make things better.
Like I said, we've been doing our podcast with Healthcare Reinvented for like 6 or 7 years now. We've been looking at these intersections of technology and healthcare, and that to us has been, it's one of our passion projects that I think we both share together.
It's been great
being able to interview all the different execs, and he kind of gave a little taste that I think technology goes hand in hand. It is part of the thing that is just going to lead with all things at Highmark and AHN.
It'll be the differentiator for all of us in healthcare.
Oh, without a doubt. Talk to me about when you were up there asking him a bit about how he actually integrates with our tech companies here, and he brought up a little bit about what he's doing with Innovation Works and AlphaLab, which I think is really cool. And actually, I interviewed a company that just came out of there that I was just very excited about, that's doing some work around if you have a catheter or a feeding tube, they get dislodged.
Yeah, they do.
And this startup has a solution that encapsulates it and keeps it from being pulled out. It's like a 37% rate that these things pull out, which leads to infection and things like that.
Home, right?
Yeah. So he's actually been piloting that within AHN as part of being part of AlphaLab. What are your thoughts on them being able to work with?
Well, listen, AHN, it's been even pre-Mark coming into this role over the last, he's been in the role about a year.
Right.
David Holmberg has really had a vision by working with Dr. Jeff Cohen,
Definitely.
who we've met.
We've interviewed him before on TechVibe, absolutely.
And their focus has really been on what are some of the biggest innovations and how can they sort of harness that when people have all these ideas, including physicians, including people who are inside the system.
Yeah.
So they have a place in Bellevue, which is like an old hospital.
An old hospital. They've repurposed it.
Totally repurposed it. But Highmark has made a contribution as a strategic partner, so that people have an opportunity to play in the sandbox and test those ideas.
Is that unique to Pittsburgh at all? Is that something that is that happening in other regions? It happens a lot. Okay,
sure.
Cool.
It definitely does. But Highmark definitely has made a commitment to that in partnership with Innovation Works, so that they can sort of, like what I say, harness these ideas and create places where they can play and figure out and convene with doctors. But I know that you talk about Ambridge. The whole notion of Abridge and this ambient
the ambient listening so
is
cool.
Just really fascinating
100%.
Because it's not transcription. It's, it's discerning. It's collecting everything and then discerning.
And then assigning it to things so actions get done so the doctors don't have to do it and everything. But I do have a little clip here of him talking about what they're doing with Innovation Works and AlphaLab, because I think that's really cool when you can have some startups actually get some traction in a hospital as they're a startup and help them along the way. We'll give it a spin. What do you say?
Let's do it.
Okay, let's do that.
And as I've always said, one of my favorite quotes is, if you want to go someplace you've never been, you have to try things you've never tried. And that includes bringing other ideas to the table around really good ideas that create partnerships. And, so we do have an innovation center led by Dr. Jeff Cohen that we actually can, do a lot of things that might solve a real life problem from a process perspective, but it could be technology, it could be basic science, it could be, research. And so we really have a lot of leaders here at AHN that have a passion for advancing this organization and creating a better place for our patients' experience. Or, as you say, around startup companies, there's just so many different things that can create that better pathway. So again, we love to talk. We have different forums to invite people who have these ideas to be able to vet them and understand, hey, where are you at in this life cycle of a startup? Can we actually help you with seed funding? Can we actually, participate, or can we take, ownership of an equity stake, or all different pathways here? Look forward to sharing more about that. We're a company focused on innovation, and Highmark and AHN as a payer provider is really focusing on the value proposition of not only enhancing access and quality, but with affordability in mind. And so we need technology solutions. We need to provide ways that things that care is provided more affordable. And a lot of that's going to be through technology.
So much going on with this. Like I said, I was very jealous, Audrey, because man, you got to talk with them, and I just love that you had that full hour to really kind of go through and really dig through it. And it was fun. You were able to kind of rib them a little bit here and there. I told them, I said, you look at it, I said, Audrey's the master of the fireside chat. She might make you say things that you didn't know you were going to say.
I was pretty easy
you were very nice.
I was very magnanimous to him.
I know, and sometimes like they always want to make sure they have this script, and you always say, dude, you show a script and you kind of tear it up. You're like, yeah, you'll be fine. I'm going to take care of you.
Yeah.
I love it. I think it's just so much fun when you're able to do that with guests, because you're bringing out the human in the person a little bit. Because they got to be all like staunch, but he was not staunch at all. But but I think just the idea that you get people like comfortable and like it's you and I here. Like we can
exactly.
be cool.
Exactly.
There's an art to that, and I totally respect that without a doubt. But it's just so much fun. As he continues to talk about how they engage technology and looking at the future, he brought some really cool points up. Just how like they have these 4 kind of key things that they're just really trying to make sure they do. And they sound very basic. Like they want to be your guide. They want to care for you. They want to not fail you. Wow. It sounds so simple, but it's so powerful when they say that.
And he admitted that he didn't want to use the word fail.
Exactly.
That was just, quite clear, because fail means something negative, and he didn't want anything negative.
Fail means lawsuit or something, like you have liability or something.
I finally got with the program and agreed with it, and I thought that was terrific.
I love it. Oh my God, that's crazy. But he gave a little bit about the future of tech. I found a cool little section of your interview I think our listeners need to hear from.
All right,
let's play that right now.
Yeah, that's a big question, of course. But we know that we should be thinking about these things. Where is healthcare going? We're always, pressuring ourselves. What is right in front of us that we're trying to solve now? But we do here have stepped back and sort of taken a look at, what are the future trends? What is the technology evolution? How are we going to embrace AI? How are we going to work with different companies? And set up a Highmark 2030 and an AHN 2030, strategic plan. Now that will adapt over time. Now that's a 5-year, and you're asking about 10-year. So we really do, we start with, we want to be a great place to work and practice for our clinicians, recruit the best people. We have the best, operating model to continue to iterate and get better, and I think from 10 years from now, we need to have a more affordable platform. We need care to be more affordable to seniors, to employers. We need Medicaid to be more affordable. And so we want to be able to provide care to everybody that needs the care when they need it, where they need it. And I think that definitely there's going to be a movement to our outpatient. There's going to be a huge movement to home health care. There's going to be a huge, significant investment in AI in terms of what role that can play in terms of, awareness, education, how we access certainly our physicians. Look, predictive analytics is going to play a huge role here in the genetic makeup
Well, what a great day all the way around. I was just that's one of those days when I just realized how much I just love working for the Tech Council. I show up on a Thursday morning, in sunny Oakland where all this innovation and so forth is happening. And we have a guy like Mark Sevco here engaging with our members, talking about the future of technology in healthcare, talking about some things that could break because of legislation that has passed. What a great way to get that all out of a fireside chat conversation where we get a couple laughs out of it while we're doing it. Like, I had a great time with it. Great. And I was like, Audrey, our listeners here on TechVibe have to hear a little bit of this.
Good. I'm so glad that we can share it.
It's like a little sneak peek of being part of the Tech Council. Like, when you come to our events, this is the type of stuff that you get to be a part of. To me, that's kind of magical and really fun stuff. So good job on the interview there.
Thank you.
High grades. High grades.
Thank you.
And I'm tough, man. You know that. I'm not always Dr. Love, but I encourage everybody, if you want to learn more about the Tech Council, of course, go to our website, pghtech.org. We've got all kinds of content up there with these types of stories and stuff. So, Audrey, always fun hanging out with you here.
Same here.
In the Huntington Bank studios, having a great time. So we'll see everybody next week. It's kind of what we do every week. We keep coming back. We won't go away. You can't get rid of us. We'll see you on the next one, everybody. Have a great weekend.
Thanks for geeking out with us on TechVibe Radio. Tune in next Sunday for more tech and innovation stories right here from Pittsburgh. Get TechVibe wherever you get your podcasts and never miss a show. TechVibe is brought to you by the generous support of Compunetics at Compunetics.com, Chorus Call at ChorusCall.com, Highmark at Highmark.com, Huntington Bank at Huntington.com, the Kindling Culture Agency at thekindlingagency.com, PNC Bank at PNC.com, Savior at Savior.com, and Studio Me at StudioMeProductions.com. TechVibe proudly broadcasts from the Huntington Bank Studios.